I'll let you know a little fact. I don't throw with my right arm anymore. My right arm does not work. So when I throw in the backyard right now, I throw left-handed. It's definitely a result of the injury that I suffered when I left San Diego.
Drew Brees revealed yesterday that he can no longer throw due to this injury he suffered back in 2005. Let's break this down and discuss why this might be one of the worst shoulder injuries in NFL history. In order to understand this injury, let's review a few key anatomical structures of the shoulder. Here's the capsule of the right shoulder. This is the glenoid fossa, aka the socket. Around it is this rim of soft tissue or cartilage that helps to stabilize it, called the labrum. Around the shoulder are these four muscles of the rotator cuff, also called the sits muscles, which allows us to move our shoulders. Most specific to this injury, abduction, which looks like this. Now let's break down the play during which the injury occurred. From this angle, you can see Drew Brees is going to dive and reach out for the ball, and his right arm becomes hyper abducted or forced beyond the normal upward position when the defender number 61, who is at least 300 pounds, lands directly on top of his back. This direct loading force on the hyper abducted arm allows for disengagement of the humeral head inferiorly or downward from the glenoid socket. Here you can see it gets cocked back so far you can almost visualize it getting ripped out of the socket. What's gnarly about this is that after the play, Drew's arm is stuck in this position. This is called luxatio erecta, or to be placed upward, because the arm appears to be permanently held upward in a fixed abduction position. This is because the socket is dislocated back here and is literally locked in place until it's reduced back into the joint by the medical staff. Brees suffered an inferior shoulder dislocation, which accounts for 0.5% of all dislocations, making it one of the rarest injuries to occur on turf. This was complicated by a full thickness labral tear and a partial thickness rotator cuff tear. Brees is very fortunate because this specific injury commonly has neurovascular injuries associated with it, which can lead to permanent damage to the arm and hand, cause issues with motor function and movement, as well as sensation all the way down to the fingers. Welcome back to the channel, everyone. I'm your host, Dr. Nav. If you guys are learning something new, don't forget to give this a huge thumbs up, and please smash that subscribe button. It really helps our family grow. Thank you. He had surgery in 2006 via Dr. James Andrews, who performed a 360-degree labral repair with 12 anchors, the most he had ever used at that time, and he also repaired the partial tear of the rotator cuff muscles. The reason he's unable to throw now is because this injury likely fast-tracked him towards degenerative osteoarthritis of the shoulder. Osteoarthritis of the shoulder occurs when the cartilage of the shoulder wears down and exposes the bone, causing narrowing of the joint space, and it also gets worse with friction-induced inflammation. You might remember near the end of his career with the Saints, Drew Brees lost a ton of arm strength and he became a master of the short pass game and dump offs. There's no question that him continuing to play and throw as much as he did after the repair led to bone spur formation in and around the joint space, which can make it difficult and very painful to move around. Now that it's gotten to this point, Drew Brees does have a couple options. He can elect to have a total shoulder replacement, also known as a shoulder arthroplasty. This involves removal of portions of the shoulder joint, which are replaced with artificial implants to reduce pain and restore range of motion and mobility. It's very successful for treating severe pain and stiffness caused by end-stage arthritis. Another non-surgical option could be stem cell therapy. There is some evidence that it can accelerate healing and regenerate articular cartilage. That's it for our video today, guys. If you learned something new, be sure to give this video a huge thumbs up, and please smash that subscribe button. It really helps our family grow. Thank you.